Most states are falling far short when it comes to funding programs that prevent kids from starting to smoke and help adults to quit. Let's break down where Georgia ranks, in fact, and what this means for public health with Brian King joining us this morning, Executive Vice President of Campaign for Tobacco-Free Kids. All right, Brian, glad to have you here. So let's talk about Georgia. How bad and how serious is this at a state level right now?
So things are particularly dire in Georgia. This report shows that most states are not meeting the CDC recommended levels, but Georgia actually ranks 49th, spending only about 2% of what CDC recommends based on the evidence and science to effectively prevent and reduce tobacco use.
All right, so we know the tobacco settlement money that a lot of us heard about, it was meant to prevent addiction. Where did most of that money go?
That money is going to a variety of other things, including filling potholes and not things related to public health. If those dollars were expended for public health, including tobacco prevention and control, we could see sizable increases in extra funds. Nationally, it would be around $6 billion. Implementing these evidence-based strategies that we know work with effective dollars could be very useful at reducing tobacco-related disease and death.
Absolutely. Well, let's talk about Georgia again, more specifically. Not good news that we rank right near the bottom. In fact, just 2% of what the CDC is actually recommending. So what does that mean and the work that we still have to do here in Georgia?
Well, tobacco use remains the leading cause of preventable disease and death in this country, and that includes in Georgia. And tobacco use continues to kill nearly 490,000 Americans every year. And so we know what the problem is, but we also know what works. And one of the most effective strategies to help reduce cigarette smoking is increasing the price of the products. And so just for an example, in Georgia, increasing the tax on a pack of cigarettes to $1.50 would prevent 5,400 kids from smoking, prompt nearly 30,000 adults to quit, and even raise over $300 million in revenue in the first year alone.
All right, Brian, our lawmakers just went back in session here just a couple of weeks ago. This is not necessarily one of the hot topics right now, but what's one of the biggest changes that our lawmakers could make right now to really see a difference?
It ultimately comes down to implementing those strategies we know work and following the science. And as I said, increasing price is the single most effective interventions to reduce consumption. It's no surprise and coincidence that the states with the highest taxes on these products have the lowest levels of use. And in that being said, Georgia has a profound opportunity to increase that cigarette tax and in turn would see sizable increases in not only benefits to health, but also additional revenue that they could allocate to public health and help further fund and reduce this completely preventable health risk. All
right, Brian King joining us live this morning. Brian, some good information there. We appreciate it. Thanks so much.
Thank you.